In this video, we offer a general description of what to anticipate when inspecting a piercing studio. The order of events from beginning to end of a piercing procedure can vary between studios, and local regulations must also be considered. Though there are multiple valid processes you may see, you should always expect universal precautions to be followed. Workers in the studio should perform their duties as if each client carries a bloodborne pathogen. When a client arrives at the studio, they'll be asked to provide their identification, and they'll be given written or digital aftercare instructions for taking care of their new piercing. Verbal aftercare instructions can be given throughout the procedure as clients ask questions. They'll also complete an informed consent and release form. You can read more about this in the Body Art Model Code. The piercer will examine the procedure site. A close study of the anatomy reveals the ideal placement and jewelry size and style, or whether or not the piercing is even likely to be successful at all. Not every client has suitable anatomy for the piercing they want. If the piercer feels confident in their ability to proceed with the piercer or another staff member shows the client jewelry options best suited for their specific anatomy. Body jewelry is always tailored to fit the client and should never be seen as one size fits all. The Body Art Model Code establishes jewelry material standards for initial piercings. The order of some steps in a piercing procedure will vary depending on the facility. Some studios use cassette-style autoclaves, which means they'll be sterilizing most instruments like needles, forceps, receiving tubes, and jewelry, and other disposable products like gauze and cotton swabs at the time of the service. In other studios, piercers have nearly everything, including jewelry and their instruments, pre-sterilized in pouches. There can even be a combination where certain items are stored sterile in pouches, and some products are stored clean and sterilized at the time of the service. Many studios use disposable single-use instruments like plastic forceps and receiving tubes, which may or may not be shipped pre-sterilized. The Body Art Model Code requires a body artist to wash their hands before and after performing body art. This is often done at the beginning of setup for a procedure and after teardown is complete. Here are some basic steps for setup. Piercers work from different surfaces. Usually a Mayo stand, which is portable, but sometimes they work from a fixed counter space. This surface is where they set up all the things they'll use during a piercing procedure. The Body Art Model Code says, surfaces must be cleaned and then disinfected with an EPA-registered tuberculocidal disinfectant prior to and after the body art procedure. Disinfectants must always be used according to the manufacturer's instructions, which includes the amount of time the product must remain wet on the surface. When a piercer dons gloves for setup, and again when they're cleaning and marking, they'll need to use caution to avoid cross-contamination of their gloves. The piercer will lay a barrier over their tray or counter space. This is often a moisture-resistant dental bib or plastic sleeve used to protect the surface. It's important to note these barriers are not usually sterile, and if not, they're not suitable for placing sterile instruments on. If a piercer is working out of sterilized packages, they need to confirm that the chemical indicator shows the package was exposed to steam in an autoclave, or EO gas if they're using instruments that were shipped pre-sterilized. If so, they'll be placed on their work surface. When opening packages like this, it's important that the sterile fields inside each package aren't compromised by non-sterile gloves or the sterile contents moving to non-sterile surfaces. When a piercer is working out of a cassette autoclave system, the piercing instruments, needles, jewelry, and other products are usually sterilized together at the time of the service. They'll be wrapped in a barrier of some sort, usually CSR wrap like this, which creates the sterile field they'll work from. With either setup style, a piercer may use separately packaged products used for cleaning and marking so they don't have to reach into their sterile areas with non-sterile gloves. If a piercer needs to retrieve new packages or products during a procedure, they need to be aware of when to change gloves, how to avoid cross-contamination, and when to wash their hands again. It's important that there are no obstructions that can prevent proper cleaning or even safe piercing. Glasses, hair, hats, and other accessories may need to be removed or secured away from the procedure site. Piercers have different antiseptic options like antimicrobial soaps, iodine, alcohol, and mouthwash for cleaning the procedure site. It's important that the products are suitable for the tissues being cleaned and manufacturer's instructions are followed. Piercers mark the skin as a visual guide for precise placement during the procedure. This also gives the client an opportunity to see their piercer's vision for where the piercing will look and heal the best. Marking the skin for a piercing is done with non-sterile or pre-sterilized markers used for surgical procedures, sterilized toothpicks and an antiseptic dye called gentian violet, or even just the back end of a piercing needle or needle blank pressed into the skin to make an impression. Some piercers clean the procedure site with antiseptic before placing their marks and do a second cleaning after marking the skin. Cleaning first with alcohol, marking, and cleaning again with iodine is a popular combination. Piercers make these decisions based on the tissues they're piercing, the products they have in their studio, and whether or not their client has a known sensitivity. The Body Art Model Code requires a piercer to wear sterile gloves when performing a piercing. It's important for a piercer to be proficient in donning sterile gloves so the outside surfaces don't become compromised. During the piercing procedure, the piercer must use caution to not cross-contaminate the procedure site, jewelry, or instruments. Cross-contamination happens if the piercer's sterile gloves, instruments, or other disposable products come into contact with non-sterile surfaces or items like clothing, hair, or tissues not previously cleaned with antiseptic. Many piercers use sterile barriers like this sterile fenestrated drape. Sometimes the piercer decides to clean a new piercing after it's complete. Piercings will sometimes bleed when fresh, and piercers generally want their client to see a new piercing without blood or dye left over from the marks. This is usually done with saline wound wash, but an antimicrobial soap or other similar product may be used. After the service is complete, the piercer needs to safely tear down their setup. This comes with the added risk of contaminated sharps and other products and items that have a reasonably anticipated presence of blood or other potentially infectious materials. Teardown should always be done with gloves on, which means the piercer needs to wear at least their third pair. Needles and other sharps need to be removed from the workstation and cautiously placed into the sharps container. Rather than using their hands, a piercer can use forceps or hemostats. Reusable instruments need to be carefully placed in a bin to soak until transferred to the decontamination area. Usually these instruments soak in a hospital-grade disinfectant or enzymatic solution made for soaking contaminated medical instruments. Disposable products that will go in the trash need to be cautiously bundled together and placed in the bin. It's critical that there are no sharps remaining on this tray before the rest of the trash is removed. New gloves need to be worn for disinfecting the surfaces used during the procedure, like the mayo stand or countertop, and the table, chair, or bed the client was on. In this video's piercing scenario, a minimum of 4 pairs of gloves is worn. The final step is hand washing.